Quickly, Juice, can you say hi? Make sure your mic works.
Hi, everyone.
Perfect. No worries. Great. We'll invite you.
Welcome everyone. The session will be starting in just 1 minute. If you can hear me, your sound's working and there is no sound to go with these slides. Welcome everyone. The session will be starting shortly.
Hi, I'm Barb Turpin. I'm professor and chair of the Department of Environmental Sciences and Engineering at UNC-Chapel Hill. Welcome to the 2020 UNC Water and Health Conference. This is my 5th year attending the conference. I'm excited because this is Environmental Sciences and Engineering Department's centennial year, and I'm excited because there's so much representation from so many countries at this conference this year. Welcome to the conference.
Hi, my name is Mohammad Rafiuddin from ICDDRB, Dhaka, Bangladesh. Welcome to the 2020 UNC Water and Health Conference. This is my first time attending and I am most excited to see my poster and side events where my project showcasing my work.
Hola, soy María Mercedes Medina, gerente de Cambio Climático, Amazonía y Gestión de Recursos Hídricos de CARE Perú. Los saludamos desde Lima. Bienvenidos a la Conferencia de Salud y Agua de la ONDC 2020. Es la primera vez que participamos y estamos muy emocionados de poder compartir con ustedes nuestro side event, integración a una adaptación basada en comunidades y de gestión del recurso hídrico resiliente al clima, con la planificación del saneamiento y la higiene, el cual vamos a realizar el día 29 de octubre. Los esperamos.
Hi, I'm Ian Moise, and I lead the Water Services work at DT Global in Washington, D.C. Welcome to the 2020 UNC Water and Health Conference. I've been attending the conference since 2014, and I'm definitely looking forward to the virtual format this year. Come and say hi and learn about Profit for Purpose. Thanks so much.
Hi, I'm Nikki Beetsch from NSF International in Ann Arbor, Michigan, the United States. I've been coming to the conference, and NSF has sponsored the conference since its beginnings in 2012. Welcome to the conference.
Hi, my name is Bram Reems. I work for Action Against Hunger and I'm based in New York. I'll say this in Dutch. Welkom op de 2020 editie van de Water- en Gezondheidsconferentie. This will be my third year that I'm attending the conference, and this year I'm especially excited about the COVID-19 sessions. Hope to meet you online. Bye.
Hi, this is Amrita Mahtani from RTI International in Washington, D.C. in the U.S. Welcome to the 2020 UNC Water and Health Conference. Excited to be participating for the second time and present some really interesting work that we've been doing in Nigeria.
Hello, my name is Shauna Curry. I'm the CEO of COST, the Center for Affordable Water and Sanitation Technology, bringing greetings from snowy Calgary, Canada. It's full-on winter here. Welcome to the 2020 UNC Water and Health Conference. This is my second time attending, and it's just really great to be connected with all of you.
Hi, my name's Clarissa Brocklehurst. I'm an adjunct professor at University of North Carolina, affiliated with the Water Institute. I'd like to welcome you to the 2020 Water and Health Conference. This is my 12th time attending the conference. I've been there since the very beginning in 2009, but I'm particularly excited about this year because it's online and we've been able to make the registration free. It means that we are getting registrants from all over the world, and I think it's going to be an exciting new way to do the conference. I'm really looking forward to it and hope you are too.
Hi, my name is Lauren Alcorn. I'm from the One Drop Foundation, based in our headquarters in Montreal, Canada. Welcome, bienvenue to the 2020 UNC Water and Health Conference. I'm very excited this conference is still running this year despite all the challenges we are all facing with the pandemic. I'm happy to see that there's a WaSH and healthcare facility session, and of course, we'll be in attendance at the Thursday session on behavior change. See you there.
Good morning, good evening, and happy Wednesday to all. I hope you are enjoying the conference so far. We are at the halfway point, and for those of you just joining us today, we're so glad to welcome you, and we look forward to the coming days ahead. As of 2 p.m. yesterday, we passed the 3,000 registered users mark for the conference website. So welcome aboard, everybody. It's great to have you. And I see that there's a lot of discussion and a lot of comments and a lot of questions coming in for presenters, and we love it. So we encourage you to keep it coming and keep engaged. Many of you by this time may have reached a little bit of Zoom fatigue, but we encourage you to stay with us, hang in there. We have a lot of great things still in store for you today. And so I want to make an announcement that we will have a special session this afternoon led by Clarissa Brocklehurst on sanitation, new pathways to action and scale that I wanted to let you know about, and it starts at noon, 11:45, sorry, today. We also have a special session for young professionals later on in the day, and we will feature Jennifer Murphy, Brooke Yamakoshi, Christine George, John Brogan, Emmeline, and Lauren Rizzi. So please join us and all the young professionals out there who want tips and tricks for getting a job in the WaSH sector. And please join us later this evening for those of you in Asia and the Pacific, and anybody who's interested in attending tonight's conference recap that we're calling the Late Early Show. And tonight it will be hosted by Joe Brown. So please join us for that if you are still up at 11 o'clock tonight. We also want you to attend our poster presentations. Tomorrow will be the last poster presentation, so stop by and chat with the presenters and interrogate the science and the scientists. And we also want to take time during the conference to remember Dr. Val Curtis. Our deepest condolences go out to Val's family and friends and colleagues. She will be missed. She was a champion and a leader in the sector, and we want to recognize her contribution and make sure that you check out her recent lecture. But also, if you're interested and you knew Val, please leave a message on the London School of Hygiene's Kudo board. And we've left that link in our daily announcements. And so we will greatly miss you, Val. And so now I would like to turn the conference over to the next plenary and to Dr. Aaron Salzberg, who will lead us in the next session. Thank you.
Thank you, Keita. We've all benefited, of course, from the work that Val did, as well as her unfailing passion for WaSH issues. She will certainly be missed. Well, it's my extreme pleasure to welcome everyone back for the second plenary event of the 2020 Water and Health Conference on Systemic Inequalities. For some of you, it's likely very early in the morning, and for others, it's very likely late in the evening. Regardless of where you are, we appreciate the effort that you've made to join us. For many of us in the global north, it's probably pretty easy as we connect from the comfort of our homes and offices. But for some of you in the South, we know that you've been scrambling out at odd hours to find a place with good Wi-Fi so you can watch or listen, perhaps even on your phone. We appreciate the special effort that you've made to join us and to be part of the conference. And we want to acknowledge that we know that the way in which we're holding our discussion about systemic inequalities is itself an example of a systemic inequality. Those of you know that those of you that know our conference know that we like to use these plenaries to challenge ourselves, to review the evidence, to stimulate critical thinking, and to try to look at our work in a new way so that we can learn and do better. In many ways, today's plenary is no different. Addressing disparities and advancing equitable access to WaSH services is a core goal of the Water and Health Conference, and in my view, gets to the heart of who we are as a sector and why we do what we do. After all, this is what we're about. Not water and sanitation for some, but access for all. But it may be that we're allowing, either consciously or unconsciously, systemic inequalities to stand in the way of our achieving this goal and achieving the real impacts that we hope to have for the beneficiaries of our work. This is the space that we hope to explore in this plenary discussion. So welcome. I'll be frank, I've struggled with how to introduce this topic. At times, planning for this session has made me uncomfortable as I've reflected on my own fears and failings, at times even paralyzed. In the end, I think that this fear is what makes it easy for us to avoid discussing these issues. But this is why we thought it was important for us to talk about these issues today. There are times when we just need to say things out loud so that we can acknowledge where we are and begin to think about where we need to go. And so, like many of you, when I look at where we are, I'm shocked, I'm humbled, and I'm concerned. How is it that so many of us, especially those of us with white privilege, have remained ignorant of the growing issues around the unequal treatment of people of color within the United States, in particular Black, Indigenous, and Latino communities? That we've ignored or left unaddressed the deeply rooted systemic practices that have led to the indiscriminate attacks on and the discriminatory treatment of communities of color. That we've ignored the growing wage and wealth inequalities here in the United States and across the globe. That we've turned a blind eye to the fact that the average white family in America has roughly 10 times the wealth of an average Black family, and that in some regions, the average Black family has less than $10 in total wealth. That we, and likely even our children, won't see gender parity in our lifetimes. That at current rates, and this was before COVID, that according to the World Economic Forum, it will take 257 years to close the economic gender gap, deeply impacting communities of color and low-income communities around the world. That Trayvon Martin, Rayshard Brooks, Daniel Prude, George Floyd, Breonna Taylor, Tatiana Jefferson, Ara Rosser, Stephon Clark, Botham Jean, Philando Castile, Alton Sterling, and countless others have had to die before Black Lives mattered. That why we have watched as 1 in every 920 Black Americans and that 1 in every 1,100 Indigenous Americans has died due to COVID-19. That the meaning of Black Lives Matter, that Black lives are disproportionately marginalized, systematically marginalized, and that we have failed to value Black lives in the same way that we would recognize our own is still accepted by so many. That we use our ability to speak English well to oppress, to manipulate, and exert power over others. That we use our titles, education, privileged status to exclude, intimidate, or limit opportunities to others, to push other faculty, educators, and researchers out. That we've stood by and enjoyed our status, while many of our neighbors and partners who easily work as hard as I do have lost their jobs, can't pay their rent, are standing in long lines outside of food banks, or live and struggle every day in conditions that are not safe. This is also true for the work that we do on water. That providing water and sanitation services to an informal settlement on the outskirts of a city, we are allowing the government to skirt its fundamental responsibilities and continue its oppressive practices of not legally recognizing marginalized communities. That it's easier for us to provide the services than to force governments to recognize the rights of these individuals and grant them land tenure, access to capital, and extend municipal services. That providing wells to rural villages that are safe from microbial contaminants, but are contaminated with lead from pipes and pumps, may, while preventing the kind of diseases, one kind of disease, may be keeping children from ever reaching their full potential. That we've let the SDGs define success and have invested in vanity metrics, the number of people served rather than measures related to capacity, autonomy, community. And how often have we used the phrase, they just don't understand? That if they just thought like me, agreed with my data, agreed with my methods, we're only more rational. In truth, it's not that they don't understand, it's that I don't understand, we don't understand. These are painful realizations. We, of course, didn't get here overnight. These challenges have been with us forever and exacerbated through colonialism, slavery, and divisive politics. But the blinders of privilege have made it possible for many of us not to feel the daily reality that many others are exposed to, and the same sense of urgency that many of you here have. COVID may have changed that. COVID has reminded us of how fragile life is at a global scale and how ill-prepared we are to address the challenges that we'll face in the 21st century. Challenges like the spread of infectious diseases, climate change, food and water insecurity, access to basic services, and healthcare, even here in the United States. After all, our global leaders can't even seem to have a civil conversation on the most basic policy issues. We fear for ourselves, our families, our communities, and our future. And I know that I too have succumbed to pressure from others. I've adopted the vanity metrics of the SDGs, and I've been driven by the numbers, maybe at the expense of the very people I've been hoping to help. So for some, COVID may be a time of reawakening, but at the same time, I want to acknowledge that many of you have long been aware of these issues and are likely further along. You know this either through your own personal experiences or because of the work that you do. This is especially true for those of you that come from communities that have experienced long-standing systemic inequalities and deal with these issues on a daily basis. I hope that for today's conversation that you'll stay with us and share your experiences on how we can chart a path forward, because this is the goal of today's plenary. It's not to blame, instill guilt, but to find a more deliberative way forward with our eyes wide open to the impacts of our own actions and to move beyond the paralysis and the fear. I'm really excited to bring forward 5 brilliant colleagues today who I hope will have some answers, or at least help us advance our conversation and push our thinking. Each one of them, and I've had great conversations with each one, has had significant experience working in low and middle income countries, working across differences and building consensus across a mix of stakeholders, and I hope represent a diversity of viewpoints. Before I introduce them, just a few conversational norms. First, I've used the term people of color in my remarks, and I recognize that Black and brown people around the world are the majority of the global population. I recognize that non-white people become people of color in the presence of white folks. This is the language of the oppressor, and moving forward, we will aim to use historically underrepresented or historically marginalized. Second, expect and accept non-closure. This is just the start of a conversation, a beginning for many. I want to recognize that many others, again, are already further along in this conversation, but we're hoping that we get to answers. Third, ask questions and make suggestions. We're going to try to answer as many questions on the Q&A as possible. And as I said, each of you, I'm sure, has contributions to make. Use the chat function. Please raise your concerns, raise your issues, share what you've got on the chat function. Let people see what you've learned and what we can benefit from. And finally, stay with us. If you're anything like me, this may be uncomfortable. That's okay. We're not pointing fingers. I invite everyone to stay in the solution, help us identify new ways of working. And so please stay with us. All right, so let's get to it. I'd like to invite my panelists to turn on their videos, and I'll ask them to introduce themselves one by one, and I'll call on you based on how you appear on my screen, if that's okay with all of you. And so maybe we'll start first with Nick. Nick, can you please just introduce yourself, tell us where you come from and who you are?
Thanks, Aaron. My name is Nick Hepworth. I'm the Executive Director of Water Witness International. It's an NGO based here in Edinburgh in the UK, which takes action and does research and targets advocacy for equitable and sustainable water management.
Great, thank you, Nick. Yeah. I'll come back to you. Sorry, I just want to make sure we introduce everybody, and then I'll come back around for some quick initial reactions. Sorry, Maitri, do you want to introduce yourself, please?
Yes, hello. Thank you so much, Aaron. My name is Maitri Das, and I work at the World Bank. I manage a set of global programs that have to do with urban development, disaster risk, and land. I have, for a significant period of time, also been the global lead on social inclusion until recently for the World Bank, and have been working on these issues for a lot longer than that. I started my career in the Indian government.
Thank you. Madhu?
Thanks, Aaron. Good morning, good evening, good afternoon, and thank you. I'm Madhu Krishna. I work at the Bill and Melinda Gates Foundation. I lead our country program on water, sanitation, and hygiene, and I also oversee our portfolio on gender equality at the India office of the Gates Foundation. Thank you.
Thank you. Welcome. And I know it's late, so thank you.
Hello everyone. Thank you. My name is Just Nancy. I work with RUSC, Dutch NGO specializing in supporting country systems of WaSH governance. I'm leading the country program in Burkina as well as the regional African program. Yeah, I've been working over the past decades to understand who are left behind for enjoying safely managed water services, how inequalities are shown, what are the root causes, and what could be the solution. So I'm honored to be part of this panel for sharing my findings. Thank you.
Thank you, Just. And Joanna.
Hello, everyone, and thank you for having me. My name is Joanna Fetch. I am the program project manager for the AU-NEPED Southern African Network for Water Centers of Excellence. So we are research and academic capacity development network in Southern Africa. Thank you.
No, thank you, Just. And again, thank all of you for joining me in this conversation. Again, it's not an easy conversation to have, so I really appreciate your willingness to actually engage on the issue. And Maitri, maybe I'll start with you, and maybe ask a really basic question. And please feel free to reflect on the opening remarks. But is this a conversation that's worth having? Is this really a problem that we need to address, or did I overplay this?
Aaron, your opening remarks were incredibly eloquent and very, very evocative. I think, forgive me for saying that isn't even a question. the fact that whether we should be having this conversation. And it's not that this is the moment to be having this conversation. I think that this has been, these are historical inequalities that we should be talking about. And yes, this is a moment where certain cataclysms collide, where COVID collides with the Black Lives Matter movement. But before that, there was Me Too. And there have been a series of movements and series of events that has brought these inequalities much more to the sort of center stage in a way that they perhaps weren't before, which is why conferences such as this have a session on systemic inequalities, which probably wasn't the case. I'm not sure if this is the first time there has been a plenary on this, but I'm seeing a lot more congregations of people that come from seemingly unrelated sectors than you would consider, say, social development or gender equality. Those are sectors that, or those are areas that would typically be speaking about these issues, but now we find much more hardcore infrastructure sectors, much more finance. There are so many other areas where you're seeing this conversation moving much further along, telling you that, yes, this is an issue that concerns not just, it cannot remain ghettoized, where only the committed speak to the committed. I think that these conversations that maybe cause some discomfort in some circles, they don't cause me any discomfort at all. I think that these are conversations that we've been having for a very long time in certain areas. They need to be had. And as you said, there isn't closure on some of these conversations. The more you have these conversations, the more questions arise. And the more you realize your own biases, and the more you realize the ways in which we're all complicit in upholding a status quo and upholding structures and processes of exclusion, of inequality that make the world what it is right now. So, I mean, I can go to I'm at a later point in this conversation onto what does this mean? So what does this mean for international aid? What does this mean for policy? What does this mean for programs on the ground? And I think that's probably the more concrete conversation that we can have in this forum, where we say, okay, when I go away and when I leave the conference, what does this mean for my work? So let me stop there, Aaron, and happy to come back on this later.
No, thank you. And that's exactly where we're going to go with this. Nick, I looked like you had some things you wanted to say when I went to that first round of introductions. So maybe I'll open it up to you. And again, just to let the other panelists know, just give me a 1 or 2 fingers if you'd like to add something to what's being said.
Thanks, Aaron. Yeah, as you know, I was thrilled when I got your call to join this panel. Most of our work at Water Witness is about channeling financial and technical support to civil society partners and communities in Africa to hold governments, private sector, and the donors to account on water. So systemic inequalities around water and development is something that we grapple with on a daily basis at all kinds of scales. And I think this conversation is a really important one to have. I was thrilled to be able to join the panel and learn from colleagues in the sector about how we can improve our work. I think one of the challenges might be, and one of the challenges we might face is that there are so many systemic inequalities, and it's such a complex and wide-ranging topic that we could use an organising framework or conceptual model to try and unpack where these systemic inequalities come from, how they manifest themselves, and therefore what we can do to tackle them and their root causes. I'll hold back on mansplaining that for the time being, but unless you want me to move ahead with some of those ideas.
No, that's great. And we should come back to that about how do we begin to frame these issues so that we can actually tackle them in a meaningful way. Juice, Joanna, I just want to make sure that you have the opportunity if you want to respond at all to the initial remarks, or give us your views about why this might be an important conversation for us to have.
Thank you, Aaron. I think most of the time, many of us as practitioners in the development world start working on inequalities with the assumption that the victims are the minority of the population. we used to think at this, that, yeah, we're talking about marginalized ethnic groups, persons living with disabilities or people living in fragile state, etc. But when we look at the figures of the GMP data of 2017, 73% of the population in sub-Saharan countries in Africa did not have access to safely managed water services, and 82% did not have access to safely managed sanitation services. Then we're talking about the majority, actually, that are left behind from enjoying adequate public services. Then I think, yeah, all these figures is confirming the needs to address this challenge. This is a very big problem, a very big need that we need to address. So that would be my input to the discussion. The size of the problem, it's like the elephant in the corridor that we have to see and to acknowledge.
Just what are some of the assumptions that we make about some of those populations that you're referring to?
There are many. I would just share a couple of them. When, for example, one of the things that we all know is that the majority of these victims of inequalities I've been talking about in sub-Saharan Africa are living in rural areas. And one of the things that I've noticed is that when we think, for example, about rural water, we all kind of systematically think about hand pumps and boreholes, while when we think as sector technicians of urban water, we instinctively think about tap water, household connection. And yeah, you know, we are unwillingly or somehow perpetuating this kind of discrimination, while the data from WHO confirms that, okay, a hand pump can only deliver basic services, and basic services are not enough for improving health. So how do we make the decision that rural people only deserve basic services and then improved services are meant for those who are wealthy? How do we make the decision about blaming the people for being poor? So this is just one example of how I think the systematic or systemic inequalities are grounded in our mindset, in the way we think, in the way we plan, in the way we see the people, and in the way we interpret their rights to enjoy water and sanitation.
Yeah, I think this is some of the unconscious bias, or maybe conscious bias, that Maitri was referring to, how we make assumptions about the types of service that rural people either should have or deserve. Madhu, you wanted to follow on that.
Yeah, I think I really want to echo this. As you know, we belong to a foundation that believes passionately in the principle that all lives have equal value. And our co-chairs and founders always push us to find the best technical solutions for the poorest. So I think that mindset really drives a lot of what we do see. And I kind of echo what Juice says. I don't think in the sector we listen very carefully and regularly to what people want. And I think even in the way that we design our questionnaires and surveys, it's about the questions we want to ask and the answers that people give. Very rarely do we see very open-ended questions. What do you actually want? What are your priorities, for sanitation? And, when you bring gender and caste and poverty all together, the intersectionality of that inequality is never factored in. Even if we do say we focus on urban poor, that's considered a very homogeneous population, whereas we know it's a very heterogeneous population. And the COVID pandemic has shown us how badly we have managed to find some solutions that just don't fit the majority of the people for whom they're made. So a concrete example would be, this over-reliance, say, in the case of urban sanitation on community and public toilets, where communities do need community and public toilets, but absolutely every one of us knows that we all want our individual toilets, and we let people get away with planning and saying, oh, it's impossible for them to have, they don't have the space, because we don't want to push our thinking, it's uncomfortable, it may be expensive. And so now when the pandemic happened, individual households had to be congested, stand in long lines, transmitted virus because they're helpless. And then the narrative builds up, oh, slums are dirty and they're carrying the virus. So this is kind of the systemic inequality that perpetuates over and over again for the poor. So then you start stigmatizing them. Oh, everyone who's coming from X slum is actually a transmitter of the virus. But the root cause is that we didn't pay attention. We are planning infrastructure, right? So exactly to Juice's point, are we asking the right questions? And are we perpetuating some of these systemic inequalities by the interventions, even when they're well-intentioned and well-designed? So I just wanted to add to this from a concrete example to bring out some of the systemic inequality, because that's kind of the headline of this panel.
No, I think that's exactly right. And I think the issue you raised around the questions that we ask is really important. The biases around data collection, data analysis, and the fundamental assumptions that we make often at the very beginning of a scientific process can really lead to significant biases in outcomes. And that's something that I think deserves a lot of exploration. Joanna, you come at this from a slightly different perspective also, because as a junior faculty member and as somebody who's starting in their career, there are other biases and inequalities that might be impacting you personally, but also things that you've experienced. I mean, is this a worthwhile conversation? Are we hitting on things that are important and need to be addressed?
Certainly. I think, and I'll start it off, I guess, from a conversation that we had, Aaron, a week or two ago, and having that conversation, I think it spurred out it really brought to the fore for me certain issues that we hold as assumptions, and some of them have already come out, especially when you're looking at it, for example, when we're looking at issues like pricing for water, for example, and the conversations we have to say that, well, the poor don't pay for water. And then, and we say, oh no, we can't expand, say, water supply in terms of proper, tap kind of access to poorer areas or to rural areas, or like what you say, to say that, boreholes for rural areas and piped water for urban areas. And it always goes to, oh, no, they can't pay. And the issue for me has become, and I think in terms of, when you start to look at it in terms of our own assumptions and what influences how we then influence policy, because I work in that kind of space as well. It comes from certain biases and assumptions that we make that are quite, that perpetuate systemic inequality. For example, when we say that we can't invest in piped water systems or, at home or, can access to water. And yet that is easy to do in urban areas. Or we say that, oh, no, the poor cannot pay. But at the same time, when you really look at who has access and who is not paying for existing systems, it's not the poor. The existing systems are there and they connect water to people that are better off. And this is especially true in countries like, say, for example, Malawi, where the majority of the population is rural. So if we're saying people don't pay for water, the poor are in the rural areas mainly, and they do not have access or they're not connected to piped water systems. Who exactly is not paying for water? And so these kind of things for me I think, having had the conversation about systemic inequalities with you and having this conversation right now, I think for me, it starts to say, hang on, take a step back and look at what your own basis for certain arguments, and saying, oh, no, people don't pay for water. But it's not really the poor that don't pay for water. It's people that already have, that are better off, that are actually not paying for water and therefore failing systems. And it's those, utilities that are not able to do what they need to do, but they're servicing the rich. They're not servicing really the poor. And yet, so that influences the way in which we start to plan or to influence policy about access to water. And this for me has become something that really I'm grappling with. And I think from that conversation, I think there was a comment that you made to say that we do not have the same aspirational goals for marginalized communities. And that for me has become, it's not just a calling card, but it's a point of reflection to say, when we talk about access to water, and especially access to water for rural areas and access to water for all, what exactly does it mean? Is it this differentiated, aspirations that we have that influence how we do things and therefore limit the extent to which we actually enable access? I'll stop there for now.
I think that the sentence you just made or just said that, we don't seem to have the same aspirational goals for rural communities, I think is incredibly powerful and incredibly important. And I couldn't, agree with you more in so many different ways, right? We seem to accept lower levels of service for those situations, and we don't seem to be laying the groundwork for, the same type of long-term service provision that we might in other cases. I think that's an incredibly important segue into this next part. What are the barriers that are actually keeping us from addressing some of these systemic inequalities? Is it our unconscious biases and reflections on these individual populations? Is it the way we've been trained to work? Is it what's keeping us from actually being able to address some of these issues or even appreciate that some of these issues are out there that we need to address? Are these things that, and are there examples of this that you're noticing in the work that you do?
Certainly, I think the training programs that we do and the kind of focus that it focuses on, because some of these things, I think we look at it in terms of inequality. I think we're not really interrogating what we're doing. We, for example, look at basic access, as somebody has said already. We look at basic access to be enough, and yet basic access is not adequate. And we find with defining access as basic, but it's only for a certain sect of the community. And we go into theorizing that and ensuring and ticking boxes and doing that. But at the same time, I think it's the way in which then as a learned community, if I can call it that, we then start to influence policy. And we don't question the allocations, for example, when you look at budget allocations to water and the kind of investments that are going into access to water for urban areas versus the kind of investment that government is putting towards rural water. We're not questioning that enough, I think. And we're not holding government to account even as a learned community. So we leave that to CSOs, for example, civil society organizations. And so we think that so it's how, as I think as academics, in a way, we also limit the way in which we think and accept that basic water as defined, and especially as defined for rural areas and marginalized communities, should be adequate. But is it really? So it's our thinking, it's how we approach things, it's how we don't interrogate government's spending and expenditure. It's how we accept that water quality and water quality aspects and compensation given to urban areas whose water was contaminated by a sewage burst, is fine. But we don't think that we should advocate for compensation to rural communities that for so long have been access to borehole water that is actually equally contaminated. But it's fine because, come on, it's rural areas. They should be thankful they have access to water, a borehole. So there's certain things that I think we're not interrogating enough. We're not putting it out there. We're keeping it in our theses on shelves and not really getting out there and helping the situation.
I agree with this. I know Madhu wants to say something, so I'll go to her in a second. But the idea that I do think we take the easy way out sometimes, and that putting the pressure we need to on governments for the proper government reform to ensure these populations are properly have the same access, again, to land and to capital and to all the other things that they need, I think is a critically important thing. Sorry, I know, Maitri, you've got your hand up as well. And I'll go to Nick, sorry, and then Madhu.
Okay, so thank you. I mean, that was very powerful what you just said, Joanna. And I want to focus, maybe move the focus a little bit onto something everyone's talked about, which is the issue of power in politics. And let me give you an example of the ways in which power and politics come into play as far as WaSH is concerned. So, there is an artificial dichotomy almost among technocrats between what is considered WRM, so water resource management, and water supply and sanitation. As though one side is the resource side, the other side is the services side. In fact, if you take a look at who actually has control over water resources, who has control over say, if you're talking about rural areas, who has control over that upstream water body that you're channeling to be able to provide downstream water. Those are the same people who are probably likely to have a much greater access to better water supply than those people that don't have access to land, don't have a say over, are not part of water user associations, are not people who are making decisions, who don't run for elections of the local bodies. And so power tends to be concentrated among those that also hold the resources. And that in turn affects the manner in which services are provided to those that don't have the power. So this connection between where power sits actually has a very, very definitive impact on service delivery, for instance. And one area that we have, so we talked a bit about frameworks. I mean, the framework that we used the term now sounds a bit anodyne, considering that we're talking about systemic inequalities. We called it social inclusion. And we called it social inclusion for a reason, because so as not to make governments nervous. And so it was a little bit wrecking it from within and talking about it in kind of non-controversial terms, but in fact having a framework in place that was at the time pulling together various frameworks and fairly radical in the way governments would receive it. And so I do at some point, when I don't want to hog the space, Aaron, but I do want to think a little bit from the point of view of governments and from the point of view of policymakers, and the kinds of constraints that policymakers have in order to design and implement policies and programs. And I don't mean financial constraints, I mean constraints of different kinds. So I think that it's extremely important to be able to have that influence, yes, holding policymakers to account, yes, holding service providers to account, but also working with them in order to influence design, in order to influence implementation and evaluation, to be able to put those questions in that Madhu talked about, and to be able to listen to people who are actually who actually don't have either the power or the services, and to feed that back, an amplifying voice. So I think that there's a very powerful role that this community that's around here today, which is the 350 odd participants have, where they influence not just governments, but influence the influencers. I think it's a very, very solid role, and I don't think it's insurmountable at all. And again, I think that this is a conversation we absolutely must have, but it's not as though we're having it for the first time. We've been having it for a very, very long time. So it's not the opening of a conversation. This is a conversation that's a fairly well-established one. So let me stop there, Aaron.
And Nick?
Yeah, to build on those great observations, if we think of water and development as an open system, so you've got inputs, human resources, money, you've got processes and decision making, you've got outcomes, and you've got the environment that takes place within. We can observe systemic inequalities in all of those things. So in inputs, there's no doubt that the development sector has a race and probably a class problem. A recent survey here in the UK found that only 3% of the chief execs of international NGOs were people of colour. In terms of the finance and the inputs, let's think about where that finance comes from. What conditionalities are attached to it, or expectations around the investments in development. Are the processes that we use in decision making, are they truly inclusive of the people affected by this work, or are we imposing sort of pre-designed solutions in contexts that don't quite suit that design? In terms of the environment that we work within, the tragedy is that our sector speaks in a code that restricts access and decision making to a very small set of elites like ourselves. The code is highly technical English and development speak, and frankly, if you don't speak in that language, it's very difficult for you to access development finance or influence. inevitably, if we've got systemic inequalities in the inputs, in the process, in the environment, we're going to get systemic inequalities in the outcomes. And we see far too many examples to this day of really bad aid, which create and propagate systemic inequalities in the communities that it's supposed to be serving. And I can give you a few examples of that now or later. Just a couple, even this year we're working in Ethiopia. One of the directors of a European bilateral aid organization said, "I don't give a damn if this is not sustainable. As long as I hit my log frame, that's what I'm here to do." This is about giving women sustainable and resilient jobs. They didn't have access to reliable water sanitation in those jobs. It wasn't in the log frame, so it didn't matter. My question is if we address the systemic inequalities in the inputs, in the processes, and the environment, would we avoid that bad aid? Another example are some of the governance mechanisms coming out of the water resource management sector being driven by NGOs, mainly from the US, but elsewhere, which are effectively imposing a pay-to-play watershed governance model in South America and now in Africa. I don't want to create false demons here, but there's a real need for us as practitioners to be reflective in the models that we're pushing and making sure that they're not going to lock out the communities that we're trying to help here in the long term.
No, thanks, Nick. That's really helpful. And in terms of the impediments to addressing some of these inequalities, I mean, you mentioned the fact that we don't have leadership that reflects the populations that we're actually working with. We don't have, we're forcing and imposing solutions. We're using language that's creating barriers to true participation from our partners, perhaps on the ground, that we're putting our results ahead of some other metrics that we might be using to more effectively measure social inclusion and some of the other things that we're talking about. So, really powerful, and I appreciate that. Madhu, I know you wanted to add to this. You're still muted.
Yes. Can you hear me now? Yeah. No, I just want, yes, I think I agree with everything that my fellow panelists have said. I want to change it a little bit and say, even when, and to address some of the questions that we've talked about biases, what are our biases? So I want to give an example where people have, and the governments, and I completely agree with Maitreyi, it's not that all governments come with bad intentions. There were really great intentions. They do want to focus on people who've been left out, but sometimes our unconscious biases still come out. So I'll give you a concrete example of communication campaigns, and a little bit on some of my fundamental principles about development programs, narrative building, and empathy, which is what I talked about when we think about the way we collect data. That has to be empathetic. Knowing what people want is important for us, even though we may have a strategy and think we know what people need. So the second one is about narrative building, and then we had this whole campaign, everyone knows, very famous campaign that targeted in the beginning the whole idea of ending open defecation, but really centered around trying to safeguard the dignity and safety of women. But the way that the campaign was designed, it didn't do enough of the formative research. And while it was really, yes, we want to address the needs of women, there were some real unintended consequences to the way that the campaign was designed, because when we focus on women's use of toilets, the campaign unintentionally signaled to everyone that it was actually toilets are meant for women. And that's a sort of a soft and feminized need, and that it was quite macho for men to keep going outside for defecation. So it actually rebounded a little bit on them. And the second and more dangerous for us was that it reinforced really strong gender bias, that women can only be protected and safe if they're kept inside and sheltered, that they weren't necessarily to be protected if they went outside, and that women needed to be cloistered inside the house, which was not the intent of the campaign at all. So once we kind of went back deeper, did the formative research and presented it back to our government partners, immediately, of course, this changed and the narrative changed. So I think there's a real need for us to go deeper in when we do any of our work. Are we really, again, listening to the communities, understanding how messages are landing, and what biases are we actually, as you said, actually bringing to the fore. And until we have multiple voices, both at leadership, across, I kind of second all of the work that we've done, and I'm giving you real examples where this has happened. And so even with the best of intentions, we can really play on our biases and bring that out and build a stronger narrative around this. And we're still sort of combating this, that suddenly people will say, oh, but I have built this toilet for my old mother and for my woman. I don't need it. It's fine. I've done it. I don't need it. I have one toilet. I have enough. I can go out, right? Which was the whole aim of the campaign. So it takes a long time once you build that narrative. And it's a whole generation of young men who might grow up with only my wife and my sisters and the women in the house need the toilet. So it's not about me and the whole household. And there's a whole reason why we should all use a toilet at home. So I'm just giving some of that example. And I do want to stress again, the idea that we seem to know best what people want. We need to know this is a basic design. Okay, if I give something to poor people, then this is a basic design. So again, listen carefully, look actually for the best technical solution at the most volume that you can get, and start from there, because that's what people want. They want something that's easy, convenient. Why should women have to lug all this water from everywhere? Why should families have to do it? In poorer areas, the distances are longer, not that anyone in an urban slum. So just the same systemic inequities that everyone has talked about. I'd love to hear from Joost about this, whether he's seeing some of this change. I think in India, we are seeing a huge change. There is a lot more intentionality, and we're really, if you talk about frameworks, I know, Maitri, we think we're all talking about the same things, but I do think that citywide inclusive sanitation, the kinds of frameworks, maybe they're old wine in new bottles, but maybe we have to keep doing it and talk much harder. But so thank you, Aaron. I think everyone in this room and in this conference needs to go back and see, are we being truly socially inclusive? Are we listening really, really hard and re-examining very uncomfortable biases? Whether it's in writing our papers and designing our questionnaires, are we really listening and providing the support that communities need? And second, I think also understanding that people who live on the margins actually make far more rational decisions than we can make for anyone. And this pandemic has shown that to us very starkly. Communities living in slums did a much better job of responding to the pandemic than I did sitting in my, gated community. They knew how to handle themselves in the most trying of circumstances. And women in the self-help groups in India stood up and gave social distancing measures, created wall paintings all on their own. So they know much better. We need to learn rather than teach anyone.
And we may, when we're talking about impediments, we ourselves may actually be the key impediment in the way that we internalize information and empathize and listen to others. Joost, did you want to add to that before we start talking about potential ways forward?
Yeah, thank you, Aaron. I would like just to emphasize a couple of points that the other panelists have already raised. I think it's really important to table the issue of inequality in a constructive manner. And I totally like the tone you used about this. We're not pointing fingers on anybody, but we need to acknowledge ourselves, I would say our mistakes, and what is going wrong, despite our good intentions, what we're doing wrong, so that we can improve. And I think we should table the issues with the public authorities in the developing countries and the development partners. And we need to acknowledge as, I would say, people providing support to the government in developing countries, we need to acknowledge the fundamental and critical responsibility that these public authorities have for addressing the issues of inequalities in a sustainable manner. Because, I mean, from my experience, I don't believe in any solution that bypass authorities mandated by the people for taking care of their well-being. So that would be one thing that I would like just to emphasize from what the other colleagues have already said. But the other thing that I would like to add is about rethinking or reframing the our performance indicators. That helps highlight inequalities rather than hiding them, as we've experienced so far. I mean, it happens a lot that we have good indicators. I mean, percentages are the most used, showing that, okay, 100% or 80% of the population is covered, but it's hiding a lot of inequalities, either regionally or from communities, etc. So we should rethink how we measure our performances, our progress in a way that helps highlighting the inequalities rather than hiding them. And my last point would be about being aware of the need, the critical need for strengthening country, subnational, and national government systems. Systems, I mean by systems, the whole mechanism in place for policy making, for institutional arrangements, for planning, for budgeting, for financing, for monitoring, and for accountability. I mean, it's this whole complex systems that is perpetuating actually the inequalities, and that needs to be strengthened, to be transformed in some cases for making the change we are all pleading for happen. Thank you.
Oh, thanks, Just. It's really helping to point us in this next direction, as Maitri was saying, which is, you know, what do we do next? How do we get to the right answers and solve some of these things? Nick, you and I talked briefly about this kind of metric issue and the measuring of performance, and you had some thoughts on the what is it that we're really trying to build. Did you want to reflect on some of that in terms of some of the outcomes that we should be working towards, and the, you know, sorry to steal the words from the UN, but visualizing the future we want with these populations?
Yeah, we had such an interesting chat on it. There's a lot to talk about. I think if, in terms of the metrics we use to measure progress, you know, there's been a big focus on numbers and head counts previously. We discussed around the need. What we're really trying to do is to ensure that there is competence and autonomy in the world so that people can have a self-determination in managing their own water challenges, and that their governments are held to account. So there's a need to reflect on how we measure and design aid in that light. I think maybe it's to do with metrics, but I think it's come a couple of times. There's a real need to shift from sticking plasters to dealing with the root causes behind inequality out there in the world. And we talked about land tenure as one of the examples of that. You know, why are we going around punching boreholes when, in actual fact, one of the big solutions in many places would be to hand security of land tenure to local people so that they can invest in their own infrastructure and have that security of ownership in the long term. So other issues out there like tax payments, you know, financial management, access to finance. There's a lot in terms of solutions that need to be thought through here, and solutions, better ways of doing things. Inputs, if I can just have the floor for another minute. Inputs, you know, relatively easy to deal with because we can, as practitioners, we can manage the way that teams are put together, make sure that inclusion is there, diversity in governance structures and decision making is local. Processes, again, that's relatively easy for practitioners to improve those systems to make sure that they put self-determination at the centre. The harder things to change are this wider environment that we work within, which where technical English is effectively the code words that you need to get money and have influence and power. We need to shift that, and I'm not sure exactly how we do that, but it'd be great to continue this conversation to make sure that we push towards that. Ultimately, I think there's a need for us to focus on accountability of aid. I still think that the Paris Declaration on Aid Effectiveness is a really useful model. There are very few donors out there who hold true to it. So is there a need for us as a community to look back to that and make sure that we're aligning what we've already agreed is good practice in terms of self-determination and autonomy and aligned aid? Yeah, so, you know, I hope that answered your question. I'm sorry.
No, you did. And, you know, Maitri, a lot of the suggestions that we're hearing are about how we can do our work differently. And to me, it feels almost a little bit like they're outside of ourselves. Are there things that we need to be looking at ourselves if we're going to address some of these challenges and achieve the outcomes that we want?
Oh, absolutely. And I think it starts with defining the problem. I think a lot of times we go in with instruments to address an issue, but it's a very blunt instrument because we haven't defined what the problem is. And the more further along we get, basic services, of course, basic. The minute we get into things like quality of services, the minute we think about financing, the minute we think about the complexity of the sector, we need to think back, what's the problem we're solving? Is it lack of finances? Is it the financial instrument? Is it the implementation? Is it not listening to people? So I think that ex-ante diagnostic is a really, really important part of design. And now I'm talking I'm going very granular into program design. So what do we do when we're going in to design a program? First of all, is that ex-ante design. There's so many times that I look at the ex-ante feasibility study that's basically a cut and paste from somewhere else. And that doesn't actually look at the context, and that doesn't actually look at where the problems are. And part of that diagnostic is to ask why. Why are these things perpetuating? If we are plugging in the same amount of money over a 10-year, 15-year period into a piped water supply system that still isn't working 15 years, 20 years down the line, what happened there? And to be able to learn from failure, to be able to look at unintended consequences, to be able to amplify failure, I think that this reporting on success has taken on such a big meaning that we often don't. So we basically gloss over failure, which is a very, very important learning tool. So enough said about the ex-ante diagnostics. Then about and the ex-ante diagnostics have to be done with the people whom they're affecting, and not just with them, sometimes by them. Because as Madhu pointed out, I mean, there are people who know their lived realities. And the thing is that, they say, oh, well, they're not technical. Well, they are technical. They're very often, because the innovations that happen on the ground, when people are bereft of alternatives, what they put together as innovation really is a testimony to their resourcefulness and innovation. So why can we not harness all of that and build that into our technical design documents? And so, so knowledge is power. Whom are we giving that power to? If we're giving that power to the people who are in charge, giving charge to the people for whom it matters. And it doesn't mean that the government abdicate. It doesn't mean that at all. It means that you put a system in place where you do joint assessments. And it's not about, and I think that the trick is really to have a system in place and not to do it in an ad hoc way. If it means changing the enabling environment, if it means changing laws and rules, then let's go for that, so that there's a much more collaborative ex-ante diagnostic and identification of the problem, which then, if you identify the problem well enough, then the solutions sort of stare at you in the face. And we say, I'm sort of very fond of saying this, people ask me, okay, what's a good social inclusion project? There's no such thing. It's not about doing more things or adding more money. A lot of it is about doing things differently. And it's that tweak sometimes. It's that very small tweak to an already existing. It doesn't mean you dismantle everything and start afresh. It means you build on what you already have. And so build on the years and years of investments and that have already taken place in a particular area, and to be able to make that tweak in the design, and then build a system in place that is where the evaluation / assessment, the reporting, the indicators are also co-designed. So this is it's a process of co-creation. And once that process of co-creation happens, where you leverage not just public sector financing, but private sector financing, local financing, and the amount of money that communities are putting into their own communities and into their households where services are not up to par is a huge amount. So the fact that public sector is not being able to provide those services doesn't mean people are going without water. They're getting the water from somewhere, and they're paying for that. So I think that leveraging all of those resources in both design as well as in evaluation assessment, and then feeding that back. I think that's a really important part of it, is the feedback loop for what you do at the end of a project. And finally, I just want to make this point, is that a lot of our projects are 3 years, 5 years, but the outcomes from that project are often visible 8 years, 10 years down the line. And we've already reported on a project and said it was, moderately satisfactory, unsatisfactory, et cetera, and we don't actually have a mechanism of having a continuous look at what already transpired, and then to be able to build on that. So, and then I'm talking very, very project focused, very program design focused. What do you do when you're designing and implementing a program? But it equally holds true for policy.
No, I think that those are exceptional points, and the fact that we have to be very conscious about this at the very beginning of our programs, that we need to fundamentally change the working relationship that we have with our partners, and that we need to be very, allow these feedback loops to take place so that we can continuously learn, adapt, and improve our programming as time goes on to be able to respond to some of these challenges and the way this works. Joanna, when you and I talked a little bit on the phone, we also talked about the way, you're at the other end. In some respects, Nick and Maitri are at one side where they're giving resources away and working with communities. You're at the other end where you're the beneficiary of some of these resources. As an academic, you and I, we get to get contracts and things like that. But we talked about some of the barriers that might be present that may make it more difficult for someone in your position to access funding and to be able to grow and develop and have a profitable career. Do you want to reflect on some of the things that we might be able to do that might better enable some of our partners, academic partners, implementation partners in the field to grow, develop, and achieve some real independence in the way that they work?
Yeah, so I think part of that was to look at it in terms of how, to a large extent, Aaron and I putting in a proposal equally good, there's a chance that I won't get it because my name is Joanna and I come from a university nobody knows. But Aaron has a name and it's a known name and he comes from UNC. So there are certain things, I think, when we look at it in terms of the way in which proposals or full proposals have been set up, it really, in its own way, it entrenches a certain level of, if I can put it, it is supposed to actually help those that already can or are better off or can already get in. It's harder for somebody that is from the outside, equally good, to get in a lot of sectors, and especially the water sector. I know, for example, that, you have a PI, and the PI, most of the times, everybody knows the PI, most of the times doesn't do the work. But the people that do the work are the ones that come under there, and we don't have systems in place that actually ensure that everybody in that kind of system is rewarded the same, or at least fairly, not the same, rather fairly, in terms of what input they put in there. Or if it's not about money, it's about what other opportunities are built into calls for proposals that ensure that people that work within projects are able to grow and next time can actually be the PI. So you have systems that actually ensure that unless you partner with a big name, unless you partner with a big university, it's kind of hard for you to get in. And at the same time, I think that then limits the extent to which people put themselves out there and limit the extent to which people can actually start to get confident in certain areas, because you always feel like you're failing or you have to improve yourself some more. So you find people that do a second master's, they do a PhD, not because they can't do what they do. These things are equally important, I understand, but it's because you hope that that will give you that extra edge to be listened to. But at the same time, if you're not at the right university, sorry, you better find Aaron so that Aaron partners with you so that you can be successful. I think there's certain things that we have to look at that are limiting the extent to which, as academics or as academic practice, as it happens and how we build up especially those that are coming in. I mean, it's easy when somebody's given a platform, but then the extent to which, and I think it's equally true when we look at it in terms of gender, in terms of women themselves, for example, in the water sector, and the extent to which the women that have made it in the water sector are able to say, or even to keep the door open for other women, for example, or the extent to which, calls for proposals. Everybody's talking about gender nowadays, and, but the way in which we actually get things done, one finds that to a large extent, gender, or say, for example, integrating gender in project processes and everything, and with water resources managed in be it river basin organizations or catchment management agencies. These things are usually done for, the donor said so, and never really checked in terms of how these have been put in terms of processes beyond projects and that kind of thing. So at the end of the day, you find that there's a lot of, we pale over things, and the systems are not in place, not from the, from the funders' perspective, not within the institutions that are supposed to make the changes, to ensure that people grow, to ensure that we have a pipeline that actually ensures growth, to ensure that, say, for example, issues like gender are properly integrated into systems. So that tomorrow we're not talking gender as, oh no, you have to tick that box. We see it through in certain systems, in certain programs, in certain operations in which organizations work. So there is a lot, I think, in terms of how calls for proposals are put out that limit the extent to which it actually, makes changes beyond answering a certain question. There is need for that change from that side. And of course, a change that's demanded on the people that are submitting, that ensures that, young faculty, that ensures that people that are coming up actually are not only rewarded, but they are systems that ensure that there's growth and there are changes in the system.
Yeah, so getting back to, I think, some of my earlier remarks, I think I'm now terrified because anybody watching this call is going to give you money rather than give me any money. And in fact, I think I actually told them to do that too. So I'm a little confused about myself and what all this means. Just maybe you can, you're in a kind of an in-between position where you're managing both working with giving money to some of those partners, but also trying to find ways of enabling those partners and making sure they can grow. How can we help Joanna and organizations like this? How can we structure some of the agreements that we put together in ways that might be able to address some of those kinds of challenges and ensure that we're creating the kinds of opportunities for people to grow and develop and become on par with people like me who own all sorts of advantages because of where I come from, the way I look like, and my degrees and stuff.
Yeah, thank you, Aaron. I feel that one of the solutions is sitting about being aware of the political economy, like what we also call the enabling environment, the whole system around the provision of WaSH services and the role of the key players. And then I've seen the critical role of the political authorities in the countries, the local authorities, but as well as the citizens. And our work should be strengthening their capacity to, I would say, manage and get a good understanding and managing this challenge locally. And then our role would be supporting these local systems or national systems to, I would say, properly table and address these issues over time. I also think that academics could play a specific role in documenting further the inequalities and helping us getting a better, I would say, a wider knowledge from various contexts about the bias that are, I would say, compromising or hampering our intentions and the unintended outcomes of our, I would say, systemic inequalities or our practices that are leading to systemic inequalities. I feel that the more we will know and we will learn about what is going wrong with what we've done and our good intentions, the more we would be, I would say, capable of setting back and changing our minds. I've experienced something in one village I've been working in Burkina when I get into this village just to try to understand the problems, the inequalities, why the service is not running well. I mean, these kind of things. And I was quite surprised by the result, because the figures I've got about the level of the quality of service provided was way lower than what I've seen in the, I would say, the national data. And I then organized a workshop and I tried to share my findings with the population, the local population, the local authorities. And they listened to me for a while and then just said, but we knew that you may be discovering these realities, but we knew that before. But nobody came here to try to discuss this with us. That's the difference. Confirming the point about sometimes we don't ask the right question, then we don't get the right answer. Then we don't see what is happening. And then we also measure our performance against our own indicators rather than seeing, okay, what would be the best way to see whether these people, I would say, are happy, are enjoying a better life. And I would like just to share another situation I've been experiencing over my journey of understanding the challenges. It's in peri-urban areas where people are still struggling for collecting water because they have to go to public water points and then they have to carry this in the containers, etc. But at the same time, over a survey in this area, I've been seeing that most of the households I've been visiting, people were using smartphone and they have access to internet. So at the same time, we're considering that those people are not financially viable for getting water at home. They're getting access to internet and they can access Facebook and use all this access the digital world. Just seeing that from other sector, those people are not treated as so poor that they cannot afford safely managed services. So just confirming that we have to think outside the box and think more globally. We have to step back and just interrogate our own way of thinking. And the more we get, I think we would collect knowledge about these anecdotal cases from various contexts, because it varies a lot from one context to another. The more I think we could improve, and we could also help the local systems and the national system to improve.
Great, thank you. Joanna, I know you wanted to add something to that quickly.
Yes, so it's related to the assumption that that we make, and I have made as well, that people in rural areas or at least in marginalized communities can't pay for improved services. And I've been thinking in terms of, and then some of the interventions that we therefore then take to them. And I've been thinking, I mean, if we had a conversation with them, and it comes back to this whole thing that we make assumptions for them and therefore limit the extent to which, or the solutions that we think they need. But if somebody had to go into a rural area and explain to them why water is pegged at a certain price, and to them in terms of what it means to have access to that improved service, and if it means no dysentery, no diarrhea, them being able to work, are we sure that they won't be able to pay for that water? And especially looking at the costs that they already incur because of lack of access, or what we define as basic, and therefore, all the limitations that come with that. So it's something that I'm grappling with, and I'm thinking maybe that limits the extent to which we try and intervene, or our limitations limit the extent to which we are trying to help with solutions, if at all, if we need it.
I think we're all grappling with that. We're coming close to the end, and this is a conversation that really does need to, I hope, continue, and we can find ways of making it continue. I'm going to go around one more time and ask whether or not there are specific questions or thoughts that you think we should be asking ourselves in order to achieve the kind of outcomes that we want to get in addressing some of these systemic inequalities. As we begin to, as Juice put it, I think better than any of us, which is, he said, my journey of understanding. I think we're all on this journey of trying to understand and trying to find ways to do this better. What are the questions, what are the thoughts or recommendations that you have as we go forward that might help us begin to better understand and maybe become agents of change around these issues? of systemic inequalities. And just to give you guys a heads up, I will start with Madhu, if that's okay with you. And then I'll go to Nick, Juice, Joanna, and then close with Maitri, if that's okay with all of you. So Madhu, do you have any, as we wind this down, any closing thoughts or questions that you'd encourage us to continue to explore as we work through this journey of our own understanding?
Yeah, thank you, Aaron, and thanks to everyone. I mean, a lot of food for thought, and I really do want to respond as sitting in a kind of a donor chair where we are. I think I want to request that we have a different standard for proposals also. The ones that we receive, and we're also guilty like all other donors, to the points that Nick made, and I guess Just and Joanna have highlighted. We need to set a different gold standard for what kind of proposals actually get funded, what kind of programs we fund, where we have this really strong emphasis on local knowledge, on community-based interventions that have a very strong component of that the program design itself, and that those proposals are sort of a little bit more open-ended even. We don't need the very strict log frames. I think we need to change that. And there are some smaller fixes. I think I do want to respond to Joanne's point that even when work is actually done on the ground with very local partners, they're given 2 lines of credit in the acknowledgement. We want to acknowledge XYZ Institute in Burkina Faso, but the main authors will remain the main PIs. And until you bump that and change that power, because most of that work is actually done on the ground, and there is some supervision and maybe 2 or 3 flying visits into the country to look at what's happening, I think that will help build this credibility of your local partners so that they become authors, get the responsibility without diminishing the role, because obviously we'll be hitting some territories if we say anyone who has a PhD from UNC is not really going to ever get funded because we're shifting the other way. It's not about balancing the pendulum one way or another, but it's really enabling this growth, and then also having these kinds of proposals set a new standard of how proposals have to be written, how programs have to be designed. Even when we know some of those best practices and we can have that forcing function, the sector too needs to respond to this and say, okay, but these proposals are not good. And hey, funders, all of us as a community, these are the kind of proposals that you should be looking at. And these are the ones that are going to give you impact. And some of this is open-ended. Like you're saying, we're all on this learning journey, and let's all together learn and be open to failure. And please help us be open to that and fund that. Because if we get very strict, here's the outcome that you'll get in 3 years, then it's an obvious thing, because all of us have masters that we have to answer to, and we all look for outcomes. So I think that also needs to be a joint partnership between donors and us and our partners who we fund to tell us this is a new vision. And we're certainly going on this big journey, even if we are coming in a little bit late. Very purposeful, we want to be gender transformative, look for gender outcomes, not just ticking in the boxes with gender markers, etc. We're actually looking for sectoral outcomes that give sustainable gender outcomes across all sectors that we work in. And definitely we want to be much more diverse and inclusive. And that does hit some territories, I'll be very honest. Most of our partners in India, for instance, are all Indian local organizations. It's caused much more hand-holding and grief, but until we do that, that's just the sustainable way to go. And it's not to say we're being exclusive, that we don't want international partners. We want to give the driving seat to our domestic partners. So I'll stop there.
Thank you, Madhu. No, thank you. And I think your point about this is not a zero-sum game is incredibly important for all of us to know. So thank you. Oh, so then quickly to Juice, Nick, Joanna. Juice?
Okay, thank you. If there is one question I would like us to ask ourselves to be, why don't we, I think I would start first with clarifying, I think SDGs are creating an incredible opportunity for talking about, for having these talks and having these discussions, as we consider that if we could reach SDGs, WaSH-related SDGs, then we would have solved all inequalities in the end. But then I think there's still some gray area of misunderstanding, because the SDGs, we now know that WaSH are established as human rights, and we do have the service levels defined within the SDG framework, the GMP framework. But then my point is, why don't we consider or establish that the right to water hygiene and sanitation is actually the right to a safely managed service? Rather than keeping it open, so that we start thinking whether people deserve basic service, unlimited service, unimproved services. I mean, why don't we go directly to the point about the level of service that everyone deserves, and about the safely managed service? And I think by asking ourselves this question, it would already clarify what our ambitions are actually about SDGs, and then how we work towards or for achieving this ambition.
Well, I think that you and Maitri have both made the point of how do we work in partnership with governments to realize a lot of these rights that we've set as aspirational goals for ourselves, and how do we make them meaningful for people on the ground? That's a critically important point. Nick?
Just quickly, how can we use the pandemic and the response and this time to reset or reframe aid around water and development? Can we move to models which foreground reflexivity, autonomy, ownership of results, addressing the root causes of the problems rather than applying sticking plasters, and putting learning at the centre? I love Madhu's way of phraseology, embracing failure and really learning, rather than engaging in beauty parades of XYZ program that might have done scratch the surface. Added to that, can we move away from the sometimes cynical use of imagery and language which used by some of the international NGOs, which depict Africans and other communities as helpless victims on this, rather than dynamic agents of change, which is the reality that we see. I think that perpetuates an unhelpful bias in the way the world sees itself.
Thank you, Nick. I think that's an incredibly important point, and the way we cast certain populations that we work with as victims really impacts what we do. Joanna, very quickly, any?
So it's to acknowledge really that, one, I think, is being poor is very expensive. And the development community, I think we have to acknowledge that we do a big disservice in the way in which we conduct that, and to be able to say and to improve our own thinking and understanding, and acknowledge that our aspirations actually limit the extent to which we are being a force for change, if at all. So it's more a statement.
No, it's a very, very important point. And Maitri.
Thank you. I mean, it's very little to say. I mean, I think that to agree with everyone, but I just want to reiterate something that that I said. I mean, look, the state is the preeminent agent of change. It can thwart change, it can block change, it can create barriers, or it can be an enabler. And I think that importance of the state, and to be able to influence it through learned advocacy, and to work with the state at different levels, wherever you see success, especially at local levels, it is happening with municipal governments, with local communities, with NGOs. It's a together phenomenon. And so how do we make this together phenomenon much more systematized and hold it accountable together and hold each other accountable? So that's on the to make a point about the role of the state. The second is on poverty. I think we've talked quite a bit about poverty and about people being resource poor, but it's not only the people who are poor that are excluded. Quite often, I mean, I give the example of a woman with a disability that lives in a rich household, where she's not affected by poverty, but she's affected by exclusion. So Madhu talked about intersectionality. I think it's to be able to look at the heterogeneity of identity. And there are times when if this was an indigenous woman who had a disability and was living in a remote area, that disadvantage would be hugely amplified and exacerbated. And by the same token, there would be a community in place to help. So I think that my takeaway from this would be, let's not think in terms of linear correlations between issues. So just because a person has a disability and is from an indigenous community and is living in a remote area doesn't mean that that person is a victim. It means that the person has agency, but also has huge disadvantage. So it's not an either or. Sometimes it's a lot of different things that happen together. So how do we unpack that complexity in the manner in which we design our projects and programs? So I'll leave you with those two takeaways.
Those are tough ones. How do we check our identities and ourselves at the door when we go into every community and every conversation and every individual in an individual way? I want to thank the panel. This is an incredibly rich conversation, and I'm not going to be able to do justice to this in trying to wrap it up, but there were so many good ideas that came out of this about new ways of working that help put and elevate the partners that we're working with, and don't put the privileged in charge. New ways to give credit where credit is due, to strengthen governments, to address some of these systemic challenges and work with them in partnership and give them the skills to actually grow and develop and protect and develop the rights of individuals, while keeping pressure on them. To avoid some of the biases in the way we collect, analyze, and publish data, and to build real inclusivity into decision-making and put our partners into places of leadership. I think these are all really important points, and I very much appreciate everything that the panel has contributed. I think the point that Maitri made a little bit earlier, we are a very large community of people, and this community is an agent of change, and I think we can be the drivers of real reform to address some of these systemic challenges. And so I really appreciate all of you taking the time today to help us explore that issue and to bring hopefully some greater attention to it. So thank you very much to the panel, and thank you so much for this session. A couple of quick announcements just before we close. A very big thank you to the Church of Latter-day Saints, who is the sponsor for this session, and to the Bill and Melinda Gates Foundation for their support in discussing such a critical issue. Do stick around. We have a special session at noon Eastern Daylight Time on sanitation, new pathways to action at scale. And do join us again this Friday for the final plenary event, where we'll talk, review the findings from the week and talk about how we take all this evidence to action and try to make a real difference. So see you then. Thank you again to the panelists. I really appreciate all the time and effort, and what a great conversation. Take care. Cheers. Thank you. Thank you, Nick, Maitri, Joanna. Really appreciate everything and the effort. Great conversation.
Pleasure. Thanks, Aaron.